Hi, I'm Urvi Shah, hematologist and oncologist at Memorial Sloan Kettering Cancer Center on the Myeloma service. I wanted to discuss our abstract on Daratumumab versus Lenalidomide as a maintenance strategy for newly diagnosed myeloma. My colleague, Dr. Sridevi Rajiv, will be presenting this as a poster on Sunday. In this study, this is an investigator-initiated trial looking at the primary endpoint of quality of life on two different maintenance strategies, Daratumumab and Lenalidomide as single agents. Patients on this study got induction chemotherapy plus minus transplant and then went on maintenance if they had a very good partial response and better. They were randomized to either Daratumumab or Lenalidomide and followed for 3 years. We're presenting the interim efficacy results of the study. What we do see is that single-agent Daratumumab and Lenalidomide have similar progression-free survival at 1 year and 2 years, and similar MRD negativity rates as well. This suggests that Daratumumab is an effective maintenance strategy similar to Lenalidomide. However, we still need long-term follow-up, but this is encouraging to show that we can get similar results with different strategies. So it allows us patients to have options in terms of if they have side effects with a certain option, then we have other options for them too, and oral versus coming in for shots monthly, so patients can see what works best for them. We haven't analyzed the side effect data in detail as of yet because we're still the study is still ongoing, and we just wanted to present the efficacy results. However, we saw similar rates of discontinuation due to side effects in both arms. There were slight differences in the reasons for discontinuation, such as fatigue or intolerance to lenalidomide versus infections for Daratumumab. But I think that in terms of the number, it was about similar. I also want to say, lenalidomide has been and is the standard practice for maintenance as a strategy. This is an early trial looking at a different maintenance strategy and showing that this may be another potential option. But I think it's important to discuss with your doctor as this is not yet completed.